Morning. I'm passionate about patient-reported data. That is data which is shared by patients about their own experiences of health and care. This data, which we typically collect using standardized assessments, allows us to organize healthcare services directly around the needs of the patient. High-quality research has shown that the use of these tools as interventions can improve communication in healthcare, improve identification and therefore treatment for previously unrecognized issues, leading to increases in patient quality of life, improved outcomes, especially in mental health settings, improved satisfaction with care, and most recently in landmark studies conducted in the United States and Europe, improved survival in patients with solid metastatic tumors. This is a great deal to be achieved by what is such a simple intervention, a questionnaire. And it is exactly the simplicity of the intervention that our lab is fighting to improve. When we first started collecting patient-reported outcomes information in psychiatry in the 1960s, the state of the art was a piece of paper which was scored with a pencil and fed back to a clinician as a single score. Unfortunately, the state of the art currently is essentially a piece of paper put onto an electronic screen which performs more or less exactly the same operations as it has done since the 1960s. Moreover, this technology hasn't moved on much since the first psychological assessments were made 4,000 years ago in the Xia dynasty in China. To tackle this dire need for improved nuance and quality of patient-reported data interventions, our lab are focusing on 3 interlinking streams. And these streams are designed to reduce the response burden, to increase the quality and actionability of data, to improve the clinical meaning, and also to create new insights to streamline hospital services. First, I'd like to talk about computerized adaptive testing to reduce response burden. A technology developed in the 1960s and widely incorporated in educational assessments in the US and elsewhere, computerized adaptive testing, or CAT, is not something that we are using regularly in healthcare. The CAT algorithm mimics an intelligent doctor who only asks the most relevant questions of patients to get the information which she needs. My work with the World Health Organization has shown that by applying this algorithm to their WHO 100 questionnaire, I was able to shorten the questionnaire by 82%, resulting in a time saving for each patient of 10 minutes of assessment time, and scaling up to my research sample of 10,000 people, saving 55 days of time. At Partners, we have thus far collected over 400,000 questionnaires in this way, but have not applied computerized adaptive testing. Had we have done so, we could have saved 7 years of patient time in the assessment. Secondly, I'd like to talk about machine learning and how we're utilizing it to improve the clinical meaning and actionability of patient-reported data. The goal in the Department of Surgery is to take data which we have collected, both clinical and patient-reported, and train algorithms using that data to make accurate predictions about likely outcomes for individuals who are deciding on different treatment modalities. We took data collected from over 3,000 women across the United States as part of a large NIH-funded R01 trial, and we used that information to train a set of ensemble algorithms. By doing so, we were able to create trained algorithms that could predict an individual's outcome following breast reconstruction and mastectomy with over 80% accuracy. Finally, I'd like to talk about natural language processing and how that offers an opportunity to essentially reform the way in which patient-reported experience is collected, analyzed, and utilized. Currently, patient-reported experience is typically assessed using standardized questionnaires, which are designed for benchmarking. Benchmarking allows us to easily compare different providers or different institutions using a single numerical score. The downside of a single numerical score when trying to inform quality improvement initiatives is it's very difficult to understand what is driving that score. At the Prove Center, we believe that the information we gather on patient-reported information ought to be specific, and it ought to be immediately actionable. And we have developed a proprietary system with funding from the National Institute for Health Research, both in the United Kingdom and startup and accelerator funding here in Boston, to allow patients to report on their experience in an unstructured and open text way, a more natural way, and to take that open, unstructured data and to draw from it insights that can be used to directly improve care. For example, here, we see that we can feed back to a clinician that 15% of her patients are confused because they lack the information that they want to have, particularly about their uncertainty about recovery. The feedback of this information allows for immediate modification to care and improvement. And we would expect to see a resultant increase in the quantitative comparison metrics, such as HCAHPS. All of this is possible because of a software that we have been developing at the University of Cambridge called Concerto. Concerto is an open source software solution that empowers researchers and clinicians to develop assessments that involve computerized adaptive testing, natural language processing, and also adaptive user interfaces, and to rapidly trial and improve these interventions before taking them to market. At the Prove Center, we're running 2 concurrent projects. One is focused on patient-reported outcomes and one on experience. Our outcome study, known as Improve, is in collaboration with Harvard Business School and designed to provide comprehensive value-based assessment for all women undergoing treatment for breast cancer at Brigham and Women's Hospital in Dana-Farber. Inspires is our tool designed to empower providers to know what patients really think about the care that they receive and to act in a focused way to improve that. Thank you very much. I'd be delighted to talk more about both Inspired and Improve.